So we're going to talk a little bit about BioPods today. If you watch any other videos, I'm just going to give you a quick synopsis. So BioPods is a technology about enhancing the function of the foot. Almost every other joint in the body, we enhance it. We use tubing, we use balance, we use proprioception. But the foot, we have a tendency to support dysfunction, meaning I put a hard arch in it so the arch doesn't fall down so aggressively, and I try to treat plantar fasciitis by removing function instead of increasing function. So BioPods, and you can go on the website, there's a ton of great information, but it's about supporting function or allowing the foot to work. So now I'm going to move into how do we present to our patients in that. I think every doctor in the world will say, I don't like to sell things in my office, I'm not a good salesperson, but how do we look at it as a care plan, part of what we do for patients? I think that all of us that treat backs have to say, okay, I can treat the back, but what's the reason the back came in? What's the reason the foot came in? What's the upstream reason that we're having a dysfunction? So when the patient comes in, I have my patient history, and it can be focused on your back pain hurts, and I have this type of back pain, and is it neurological? Is it related to a disc in neurology? Is it stenosis? But what do I have to know about the patient and the behavior that led to it? So when I ask a patient, I'm starting from the foot up and saying, how are we functioning? What are we doing? And almost everybody has foot type issues in that. I also try to put as much information around my clinic as possible, so people ask me questions. We have a board that in all of our dressing rooms that says, here's what we've seen this week. And it has a list of, we've seen plantar fasciitis, we've seen patella syndrome, we've seen Osgood-Schlatter's, we have a whole list. So I'm huge in having patients ask me about information. We might put vitamin D up there and have a specific topic. But what we do with BioPods is the same thing, as we put information. So this is one of my treatment rooms. This is what the patient, so I do motion palpation. We all might do it. So I put a patient in a chair. I'm behind them. I'm looking at them. But here's their visual field in that. We have brochures all over the clinic that talk about BioPods and the uniqueness of BioPods. So here's my information. I usually have a BioPods handout by me, so if somebody says I'd like to have some information, this would be, I'd be behind them, I would hand them to that. We have the BioPods on the sink that they can see as they come in and out of the room. That just shows them. So I'm trying to stimulate every which way I can for people to ask me questions. And we do that with everything we bring in our clinic, and that it doesn't matter if it's a nutritional product or, again, if it's a gym ball or whatever I'm trying to go with. We've really loved BioPods, and BioPods has become part of our care plan. So when we think about a care plan, one of my care plan is, how do I add motion to somebody in their life? I would rather replace their chair with a gym ball. I'm huge into using mini tramps in that. I love using stretchy bands and tubes in that. So how do I add something to somebody's life? So in my treatment protocols now, we talk about feet, and we just bring up feet. How are your feet doing? Let me look at your shoes. Let me look at the wear pattern of your shoes. I'm going to, as if you watched the last video, I asked them to bring a pair of shoes they've worn for a year. I asked them, let me look at your shoe. Let's look at what's going on. What's your shoe telling me about what's going on? Because, again, I want to move away from what the symptom is and upstream to the treatment plan. What am I going to do? Just like we would want to do with diabetes, can we change your eating? Just we want to do with every other symptom. I want to look at the full body. How am I treating your full body? So again, the shoe is one of the things that if they have any kind of low back pain, lower extremity pain, you can bring me a pair of shoes that you've worn for a year, if you can, and let me look at the wear pattern. Because the shoe will tell you tons. I mean, it tells you where they're landing heel strike wise, where they're coming off of their toe, where they're running. If they have the bunions and calluses, the shoe will tell me that they're sliding in a shoe, they're walking with their foot out. So I get huge amounts of information. It makes it an easy transition then to talk about BioPods, an easy transition to talk about the information. So you may decide, again, whatever your care treatment protocols are. So again, I want a patient on the gym ball. I want to talk about their feet. I want to talk. It's part of my broad picture of adding motion to people on that. And also, I'm doing everything I can to have the patient understand and see and ask me questions. The other thing which and we'll talk in the next video that we put together, we're going to talk about, so we have a front desk and we have a back desk. My back desk is a treatment area or in a clinic, and that my front desk is where we schedule appointments, we collect money, the product is sold. So I try to minimize my time as far as on that side. We have a little slip we'll show you next time. So I just mark it just like a prescription sheet. I use my social authority. When I get the patient's interested, then we've trained our front desk. They take this piece of paper up there. Then the front desk takes it from there. You know, minimizes my time with the patient, maximizes the time the patient needs for questions. And if the staff gets some other question, they just bring it back to me and say, they have these two type of shoes. They were wondering, should they buy a different type for each shoe? Whatever question is. But I'm giving them the general. I'm saying this is great. Here's what the shoe I'd like it. Here's the size. Here's the fit. The front desk will take it from there. So I'm handing it off immediately. My time talking about Biopod is seldom over 60 to 90 seconds. I mean, it's not very long, but I've set it up. I mean, we have brochures, we have information. Often I'll say, read this in between. We can talk about it next time. There's links. And so again, usually I have a two-part phase to it. Here's the information. I'll talk to you about the next visit coming. And then you have to have a system in place that allows you to remember which patients you talk to them about. So I'm going to, the next couple of videos, talk about how do we make this happen in the clinic, how's it efficient. But right now, I just have things in my clinic that allow patients to ask me questions. And I make it part of my history and part of my treatment protocols, that from the foot up, I want to make sure that I'm dealing with everything that could be having an effect on the back pain or the instability of the back pain. So thank you so much for listening today. Next time we'll talk a little bit more about how we bring it into the protocols, that this is just an introduction. Let's get the patient asking questions. Let's at least bring it up in a conversation.